Oh, okay, we're at 11 o'clock. Do we want to get started?
Sure, I think we're waiting for a couple more folks, but they can join us when they're ready.
Okay, I was going to say I can be patient too and wait. That's not a big deal. Whatever you prefer, Sarah.
Well, I was just getting off the line with Chris, and I know that she's going to be joining us, so maybe just want to wait a minute or so.
Perfect. That's fine.
Because I was expecting Brad of the DA's office as well. All right. Well, Katie, just so you guys know, my mouse isn't working, so that's why I'm having to lean forward like this. But I think if we want to get started whenever you're ready.
Perfect. Let's do that. So today is January 26th, and this is the CJCC Data Work Group meeting. We'll do a call of the order. Do you want me to read the participants' names, Sarah, or how do you prefer I do that?
Let's see. We've got Krista, Katie, Garrett, Megan, and Sandy, and myself. And I'll just announce once we do have more people join in. I think everybody knows each other, correct, at this point with this group. We might want to introduce Brad if he is able to join us. He's old face from DOC, but new to the DA's office.
Perfect. So let's go ahead with agenda item number 3, approval of the minutes from the December 2nd meeting.
I'll make a motion, Katie.
Thank you. Can I get a second?
I'll second.
Thanks, Garrett. Are there any changes or amendments needed to the minutes? Nope. Seeing none, hearing none. All those in favor signify by saying aye.
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 Aye. All those opposed signify by saying aye. None. Okay, so the meeting minutes are approved. I'll turn it over to Sarah for number 4 for the staff report.
All right, thank you, Katie. Just a couple things real quick. Started off new year, we're in January, so it's kind of nice to be in 2021, moving ahead in time from 2020. But we did have our first council meeting of the CJCC was on the 14th of January. So we've got Chris Corpola as chair of the CJCC, and then Andrea Nodoff, our DA, is vice chair for the next 2 years. The work group chairs were confirmed also, and the only change that we have is evidence-based decision-making will now be chaired by Supervisor Jim Tripp. But we've got Katie continuing on with data, so we appreciate her leadership with this group. And then we're going to be talking a little bit more on the agenda about our goals, but we discuss goals at the CJCC level and really continuing on with our council goals, and then fine-tuning those work group goals for more specifics. So ours are pretty defined, but we'll go through them in a little bit and brainstorm some other ideas and a timeline. So that is it for my staff report, unless there's questions.
Perfect. Thanks, Sarah. Number 5 is the update on Recidivism Project, our comparison group.
All right, just want to acknowledge we got Brad Erickson, their deferred prosecution coordinator, joining us, and Chris Corpola as well, our human service director. Brad, do we want to do some introductions? Do you know folks here, or I know you've been around a while, so you might.
I think I know everybody but Krista, probably. I'm Brad. I was a probation parole agent for a long time and now I'm doing the deferred prosecution stuff.
Great. Glad to have you join us. And Krista Vind is our Dunn County IT support for
Okay.
today's YouTube. She helps us with all sorts of stuff, but that's her role today.
Okay.
Okay, let's see, the Recidivism Project. So an update, we do have Rita in my office doing the research on the comparison group, because we did go through all the people that had began a program and graduated the program. So now she's going through the list to look at those that were terminated and those that were referred. So Brad, I think on your tab for the pre-charge diversion, we do need some referred dates. I'm not sure how challenging that might be for you, being that, you know, these are from years past and the access to the information. But maybe you can take a look at that spreadsheet and look at, just want to scroll down, you'll see some of the referred dates. So maybe you can take a look at that and let me know or Rita know kind of what you think you can do with that, because maybe we want, maybe if it's too much or too difficult, maybe we kind of modify that process. Just the pre-charge diversion has the most names on the list, so it's probably the most kind of challenging, kind of digging up some of that information.
Okay.
But we also have the top referred, so Rita's digging into that. Then she's looking at the treatment court referred as well. Those were kind of the comparison group. We wanted to see somebody that would typically have a similar situated case, and really what happens to them if they don't go through the program. So she is filling her time doing that work, but she did reference that she needs those some of those missing referral dates, and I think she's highlighting them in yellow as she comes across them. So. But yeah, that is one of the ongoing projects for this year that we want to report back to the CJCC as far as goals. So we can talk a little bit more about the timeline as far as when we might be ready to present this information. You know, we're still doing the legwork at this point, so there's not going to be anything near term, but as we look, you know, the year ahead when we want to be ready to present that information. But yes, it is going, and she's following, you know, before we had some of Katie's staff as well doing the CCAP research. I think at this point, Rita has enough capacity to do that. But if she, if our timeline is faster than what she can do, I'll ask Katie for some assistance. But I think right now it's just a good filler between other defined activities that she has going on. So that's the update. Any questions?
Perfect. Thank you for having her do that. I greatly appreciate it. But if I can always help out if needed as well. So let's move on to number 6, data request from Dunn County Partnership for Youth.
All right, so Kathy Asper from Arbor Place, she's the Dunn County Partnership for Youth side of the house, prevention. She is collecting data really pertaining to youth drug and alcohol use, but is asking us if we have data that we can share data with her. So she's looking at not only youth use, so it'd be youth citations related to alcohol or paraphernalia, but then also on the parent side. So this is more for Chris Corpola, but or the human service side, but you know, number of out-of-home placements that were related to drug and alcohol use. That type of information is helpful to her as well, because we, you know, part of the challenge is getting the data to really reflect the group that you're looking at. She is looking at youth and prevention services, but we're looking at more of, you know, something for the community overall, and maybe dovetailing some of our efforts that DCPFY is doing. We've got the city doing Project Hope. We're really starting to have more of these conversations focused on prevention. So if you have data that you can send to me related to use, whether it's related to parents or those youth that are coming through, and they really define it as less than 25, but I know that is much more challenging for our system to pull data than just going off of the citation. So if you have any information to send to me, that would be great. And then I can forward it on to Kathy, and then she can circle back if she has additional data requests. But really just wanting to put that formal request out to the group.
Is she looking for a certain time frame, Sarah? Like, does she just want it from like 2019, 2020, or what time frame is she looking at?
Yeah, we didn't really talk about too much of a specific timeline, but I think if you've got last year's data or the year before data, that would be helpful. And Sandy, yes, your data collection is very pertinent, just as far as that prevalence rate of the folks that are getting booked into jail. Every little bit of information can help paint the picture of some of the challenges that are going on out there.
Just sent her an email too. I normally will email with her yearly. So I just seeing what she needs, and I'll get some of that information out to you, Sarah, and to Kathy as well.
Great, thank you.
Okay, we're on to number 7, the monthly dashboards, November and December of 2020.
All right, so I'm going to share my screen. So we do have November's dashboard ready. December, I think we're still waiting on a couple of numbers to update the board, but I'm going to share my screen and pull up November. All right, can you guys see the dashboard? It's always interesting what it looks like on my screen compared to maybe what it does on yours. But we continue to have this just strange anomaly year where numbers are very different than what we typically see in a regular year. As you can see here, just the average daily bookings, are drastically down. The population's down. I do have a question, and I don't know if anybody recalls, or I can ask Doug. The demographics for November, jail demographics, show 22% were African American or Black. I was wondering if that reflected that DOC population, where we're housing some of the prison population from other parts of the state. And what we're also seeing are the trends in the snapshot where that pretrial population is a larger group at 51%, and only 20% of those that are in are serving time. So just some very different trends coming out of the jail that, it's going to take some time to parse out if this is just COVID related or actual trends we're starting to see shift. We're also continuing to see just lower rates of proxies coming in. The good news is none of them were incomplete. So those that are getting sent in are complete, but certainly we've got less law enforcement interaction out there. But the proxy process seems to be working well. Program referrals, so other portions of the dashboard just kind of show the numbers of people that are getting referred to the programs and starting the programs. So it does seem like now that we got Brad in the saddle here after Deanna's departure, that we're starting to get more referrals coming through the pre-charge diversion program. The top program, the referrals have also picked up there as well. We do certainly have a backlog of cases going on. So it's taking more time for those cases to ultimately become a referral, but they are picking up. As far as treatment court, family treatment court, those programs continue to be underutilized in the general sense. So capacity, can be up to 25 people for that program. So we have seen definitely more terminations than graduations this year in both programs. So moving on down, if you have a question, just chime in because I can't see everybody. So, all right, moving down to the assessment process. Sandy, too, feel free to jump in, but we're seeing pretty consistent trends, even though it's a smaller number of people that are getting assessed. We still see, meth to be that dominant drug that's problematic for those that are booked and brought into jail. And that could also be a reflection of just who law enforcement's bringing in versus citing and releasing. But we're seeing kind of those more folks that have more significant charges that they're facing or have potential violence or some other component that really makes them a danger to the community. As far as the reentry, so that program, has had some fits of start and stop depending on the jail accessibility, but we've got Heather Pica, the jail programmer. She has been getting the orientations up and running and really trying to engage the inmates that are there to use their time to plan for discharge and to get engaged in the programming. So they did loosen up one volunteer could go back into the jail. I don't know if that tightened up again with just the COVID kind of rates going up and down. But we are getting people in the program. They are still getting assessed by Sandy. They're having a plan for discharge. And then we've got the peer support specialist that's working with people along with Heather and some other service providers out in the community to help them make that transition from jail to community. So any questions on the dashboard?
So this is kind of, it's peripherally related to the dashboard, but it needs me to think about as I look at those jail to community reentry numbers and looking at the antisocial cognition, personality, and peer pieces. Do we have a specific treatment resource to address those?
Yes, so we do have, well, in a normal world, we would have the moral recognition therapy, so the MRT group. I know DOC has had that referral service. We have it in-house as well. But because of COVID and, working remotely, that group really doesn't function well in that virtual environment. So we have, for at least for the folks that are involved in the treatment court and the TOP program, there are resources that we purchased from Hazelden recently that really speaks to that antisocial thought process in their workbook. So if somebody is in a defined program and they have a need, they are doing some work group activities in lieu of the group activities right now. But as far as this reentry population, that's when typically those identified needs, we try to get them in the jail classes that would be most appropriate for them. And Heather does MRT in jail and does have some CBT type groups, but just getting groups together has not happened, so it's very small groups, socially distancing. So those identified needs are probably even getting met less than they were before, but there are some services.
Okay.
Yeah, and we know through research that really those are the big ones, right? Those are the ones that if we spend more of our time working on them, we're going to have better outcomes. Any other questions or thoughts? All right, I'm going to stop the share and turn it back over to Katie.
Okay, so let's go to number 8, the review of 2020 agency reports and discuss data trends.
All right, so typically each agency office produces annual reports, end of year stats, and we typically collect those and kind of aggregate them and use that information to update our 10-year trend slides that we present to the CJCC. I asked, I think at last meeting, just kind of heads up when those reports are starting to come out, and it's, you know, right about now. We're getting the end of January, early February, we're starting to see the end of year reports. So Katie already shipped out her report to me, but because this year, 2020 has just been such an anomaly, I thought it would be more helpful to hear right from the folks kind of what they think the numbers are telling us, or maybe some of the trends. So I know Katie has a report. Sandy, I know you've got your end of year numbers that you've crunched. I don't know if others have reports ready, but I thought we could spend a little bit of time just kind of seeing what folks might be, I guess, seeing from those 2020 numbers, and if there's any sense we can make of it.
I was just trying to pull mine up right now in front of me. So we were down, we've had in total of all cases with the clerk of court's office, 11,619 filed in 2020 compared to 13,413 in 2019. So, I mean, it's obviously a decrease. I expected it to be way less. I just expected, you know, people weren't out and about or weren't supposed to be, was safer at home, but really, from a numbers standpoint and a financial standpoint too, we did fairly well for revenue collection in 2020, even despite the pandemic. So I know it's less, but I'm kind of, it's a good relief in a way too, to know that there was still things filed in an odd data trending way, because, you know, we don't always want cases either. That doesn't always mean good things, but just from my perspective, it was interesting numbers.
I would agree, Katie, like it just, interesting numbers, not necessarily super decreased. I mean, we did see a decrease obviously on the law enforcement side, but we had an increase with like mental checks, welfare checks. You know, the disorderlies were more about, you know, are people wearing masks and are people getting along and things like that, and domestics, because people are stuck at home with each other. So it was just a very interesting year. Hi. Gracie, honey, stop. Sorry. I don't have daycare this week. Sorry.
All right, Sandy, do you want to share from your perspective what you're seeing with the 2020 numbers?
Yep, just kind of looking from 2019 to 2020. Obviously, just the jail numbers in general were reduced just because of the reduction of people being, you know, incarcerated because of the cite and release that we had in place due to COVID. So in turn, then, just the general numbers of my drug screeners, the gain short screeners, and the compass were nearly cut in half. The failure to appear rate in 2019, it was 30% of our jail intake list. And then for 2020, it was down just a little bit, so that's good. It was 27% of our jail intake list. And that really fluctuated day by day. There were, I know, a few days where failure to appears were half of our jail list, but on average, over the course of 2020, it was 27%. And then as far as with the drug trends, methamphetamine continues to come in first as far as the most problematic substance. The severity level of meth is up just a little bit in 2020. It's a score of 7, which is still severe. Whereas in 2019, the score was 6, which is also severe. Alcohol, that continues to be the number 2 problematic substance. In 2019, it was a moderate severity, And then in 2020, it went down a little bit. It's mild now for those reported individuals. I guess the only other like notable thing is there was more of a variety of drugs that were listed as problematic substances compared to 2019. And I don't have any data. I mean, just so everyone knows, I don't have any data for half of March, all of April, May, June, July, and then half of August. So the numbers are really, really skewed just because during that time frame, I was not able to be in the jail at all to do assessments and screenings.
Yeah, you know what I find interesting is a lot of the times the percentages are still holding true, even though the number is reduced. We're still seeing, you know, high levels of problematic drug use or alcohol use, and the mental health symptomatic seems to be at a consistent percentage as well.
Yep, and as far as failure to appear, Sarah, it's almost identical between the breakdown of males and females from last year and 2019. So it's not heavily, you know, men versus women that are failing to appear. It's pretty, that kind of a third of the females and 2/3 of the males.
I'll kind of be curious going forward to see what our failure to appear rate is. I don't see the courts, from the state perspective, I think they're going to keep the courts doing hearings by Zoom. So even, you know, let's fast forward 3-4 months, I don't know that it's going to go away with you know, more people being vaccinated. It might be something that the courts continue to do. I know in the beginning with the pandemic, it seemed like people were like, oh, we just thought we didn't have court. That was kind of, it seemed like an easy excuse. And now that they can appear remotely or by Zoom, we're getting the, hey, I can't make it today. Can I just appear by Zoom? And we're kind of taking the approach of, yeah, we'd rather have you appear than not, where before they had to write a letter, you know, and if it was a, you know, true situation, my car broke down, I can't make it in, obviously they couldn't write a letter, but I think we've just become a little bit more flexible with them. So I'll be curious to see what our approach is the next few months and how that affects our numbers going forward.
Yeah, it was right. We've talked a lot about failures to appear and just how much we really do see that take up our resources here.
I guess one other oddball thing I can throw in there, Sarah, is there, with the smaller population of people that I met with this year, there is definitely a significant increase of homelessness. So, and I know that's nothing new. I mean, we've talked about that repeatedly with stepping up, but that's just something else to, you know, for us to keep our eyes on.
All right. Anybody other data that you might have to talk about?
So this isn't directly, it's indirectly, but directly impacts the criminal justice system. Well, it's really the justice system because it utilizes court time and law enforcement time. But we have super interesting trends over the last several years, but continues to get worse in terms of the number of people who are emergency detained and have to be held at Winnebago instead of a local mental health facility. So in 20, this is a comparison. In 20, we've been tracking this data now because of some legislation that we've been advocating for since 2013. So in 2013, we had 114 total emergency detentions, and 2 of them were held at Winnebago and detained at Winnebago. And in 2020, we had 86 emergency detentions, and 28 of them were held at Winnebago. And regionally, in 2013, 5% of the total number of emergency detentions were detained at Winnebago. and in 2020, 27%. So it's a huge drain on, it's not only an individual drain on the people who need a mental health commitment, or mental health attention, but law enforcement resource and court resources and et cetera, et cetera. So it's just something that we continue to advocate for, funding for local mental health bed space.
All right, back to Katie, I guess.
Okay, let's go to number 9, review 2021 work group goals and layout timeline.
All right, so I'm going to share my screen, but in the packet, there should have been data CJCC goals and data work group goals. Just a single sheet. Here we go. But just wanted to spend some time taking a look at our goals. We've got the goals of the council itself, and then we've got the goals of the work group. So the council goals, we did agree to continue those broad goals moving into 2021. So we're focused on safety, recidivism, reducing costs, and reducing that harm and community loss. We want to use the strategies of evidence-based decision-making to identify targets for improvement. We want to maximize the use of evidence-based practices across the system. We want to operate collaboratively. We want to learn and improve based on the collection and analysis of local data. So as you guys can see, the data work group is really central to the decision making that's done on the other council efforts. And then ultimately we want to enhance the community and stakeholder communication and knowledge about all these different areas. So in particular for our data work group, these are things that we were identified for last year and recommend to kind of continue this year, but we can also add additional things or modify things and bring it back to the council. But we've got these 4 things really outlined. My formatting's off. But we wanted to measure and communicate the criminal justice data through our monthly dashboards, and then we produce our annual Smashboard. So those are ongoing projects that we want to continue for 2021. We also want to present that information to our council each year. So typically we do that kind of mid-year where we're presenting once everybody's annual reports are in, and we're able to aggregate those trends to kind of show how we're doing over time and some of the changes in the system. We also want to continue the recidivism study. So that was started last year. We did produce some a presentation to the CJCC on those that have completed programs, but we're wanting to really expand that to that comparison group, which we're working on now, and to each year annually update those stats, because at the end of each year, we've got additional people that are either 1 year, 3 year, 5 year post program that we can look to modify. And then also part of our goals is to really examine that data and to look for potential areas of change or system improvement that we can recommend to the council or other work groups to work on. And then we want to support the other activities through data collection and research, and our partner agencies, like we do with, Dunn County Partnership for Youth had some requests for information, but just being grounded in that local data and really having mechanisms that we're sharing data, and then good relationships that we can pull that data quickly, I think has just been so valuable to the CJCC and really helps us get additional funding to address some of the gaps that we're seeing. So while this, I think, seems a little bit routine at times with our data work group, in that we got our dashboard and we're just kind of having more routine projects, these are really important to our overall mission and goals of the council. So I'm going to stop talking and open it up for comments and discussion.
Yeah, so one thing I'd like to share from the DOC side of things is as of January 11th, the DOC has dramatically shifted in how we respond to violations, namely drug use. We will no longer be using jail as an accountability response. The only time jail is going to be used is when there's a risk to public safety, risk to the individual themselves. Otherwise, we'll be using other ways, such as conditional jail time. We'll look to have the judge impose that, but 2021 is going to be a very different year from the DOC side of things, and I think that's going to have a pretty big impact on these numbers that we're going to compile. A lot of things are, we want to address them via treatment as opposed to jail. So we'll see how that goes. And that's still kind of an ongoing thing. We just had a big rundown on how we're supposed to be doing our jobs from here on out. So it's kind of like learning the position all over again. And then secondly, expungement. So this might affect Brad because moving forward now, as of August, the state of Wisconsin Court of Appeals, they ruled that expungement can only be granted if the individual successfully completes probation. So in the past, we'd move forward with expungement as long as the judge ordered it, providing the individual didn't have any new charges. So now, not only is it they cannot have any new charges, they can't have any probation violations whatsoever. So, just a standard rule of supervision, if that's violated, that could, in essence, jeopardize their expungement. And I've had to tell 2 people now that were initially given the opportunity to have their record expunged. I had to tell them that, moving forward, we're not going to be able to do that because of the State v. Licks court case. So that's kind of a bummer for a lot of people. There's one girl in particular who was 19, and we couldn't recommend her expungement because she, broke a no contact with the individual. But it is what it is. So I would imagine, as more letters get sent to the court, perhaps that instead of granting expungements, the deferred option could be a better option in those particular situations where it's allowable or feasible. So that's all I have to say.
Well, thanks for sharing that, Garrett. Because I think we have heard through your supervisor and your previous supervisor, Melissa. She spoke to one of our groups about some of the changes with DOC, and right, there are some pretty major shifts in policy, and they no doubt will impact our local numbers that we see. So that's just good awareness there. And then on the expungement piece, I know that there's some pending legislation on the state front. I don't know how that impacts that court case that you were referencing, but I think the state legislature put forth some bipartisan legislation on expungement reform. So I guess there'll probably be more to come if it gains any traction. I guess we'll learn. But it's good to make that connection with the deferred options as well. If ultimately people can have, move on with their lives in being held accountable, but move on with not having that record, that can be good for their future.
So Garrett's comments about 2021 being interesting from a data perspective, I think, are thoughts that I've had, and certainly we've echoed from the kind of the major shift of how all the data looks for this year. But this is a very loose thought, so I don't know what it'll come out sounding like. But I wonder about, is there something that we should be thinking about proactively for the next year that we want to look at related to, so like I think about our ability to redeploy our entire workforce to, well, not entire, but a huge piece of our workforce to remote work within like a week. And like that would have never happened under normal circumstances. That's like a 10-year project, if then. But because we had to, it happened quickly. Well, so we've had to drive our jail numbers down, and we've had to have our, just different processes in place. And so is there something we should be looking at? Like, so for instance, I think about that data point on the dashboard about the recidivism rate in jail. So it's interesting to me that recidivism rate held at 52%, even though the jail population was a fraction of what it had previously, the bookings were a fraction of what they had previously been. And it's like, that doesn't logically make sense to me, because you would think that you would be incarcerating higher risk individuals. So anyway, the logic of it kind of was like, oh, I wonder what that means. But anyway, so all that's a long way to say, is there something that we would want to look at over the next year that would be telling to us about what the system change resulted in terms of impact or outcome within the system? I realize that's a really huge question, but.
So Chris, I noticed that 52% as well, that recidivism rate. So I'll double check that with Doug.
I mean, do we want to, so this was the one data point that I thought might be worthwhile. Do we want to pick a month or a couple months? And you got to be careful, because numbers will tell you anything. But, do we want to look at those 27 people booked into jail in the month of November and look at the outcomes for them over the next year? I don't know, something like that. Like, how do you, because the system is going to want to readjust back into the status quo. And how do you begin to potentially show that some of the changes weren't all bad and there are some positive outcomes as a result of that? Like, I'm sorry, I'm going to babble for 2 more minutes to say this, but I've always thought it was just absolutely ridiculous, not out of anyone's responsibility, but ridiculous, that if I called dispatch and said, there's a lady in my yard picking daisies, that they had to send an officer. Like, tell a lady to get the hell out of your yard, whatever, I mean? But like, it's like they literally responded to every call. And then COVID pushed them to doing a lot of phone work. And, I don't know if that's good or bad, but what I know is that it was different. And I hope that in some regards, there's some stick to that, in that some of that low level stuff that it occupies law enforcement's time just goes away or gets handled in a very different way, because it was ridiculous, some of the stuff that they were compelled to go out and check on, or respond to. So that's just an illustration of, like, I don't know how to frame that, but I think it's worth thinking about.
So yeah, I agree. I think if we can, there's been a lot of change. I think we're still in the thick of it, so it's kind of hard to see the data through all the trees yet. But we definitely have a lot of processes that change drastically, and we've continued them for most of the year. So it would be interesting to do kind of a little spot study. But we also know that those that are getting brought in probably have more significant, well, we think more significant crime issues or problems that they're dealing with. But then we're also still taking in that failure to appear population, which, we can do something very different with them. as well. But this pandemic and the response also should jumpstart the law enforcement led deferrals for the pre-charge diversion program. You know, historically, we've only seen a couple of those really come through from, directly from law enforcement. So I think there's opportunities to see more of those referrals right from law enforcement. But yeah, I think it's still kind of hard to see what we even have right now because we're in the middle of it.
Makes sense.
Sarah, I need to add that when I took the position with doing the deferred stuff, I was shocked how little pre-charge diversion there is and how little comes from law enforcement. It's a very small percentage comes from law enforcement. Most of it is decided within this office, or I review files or reports as they come in. But I just wanted to, maybe that's a real goal is to increase the pre-charge diversion. Maybe it's just educational, informational. Another thing I wanted to add was to follow up on what Garrett Bunkelman had said is we have to be very careful that we don't look at the changes in what DOC does as being either success or failure, one or the other, because it is going to change the numbers. There's a lot of numbers from them.
I just have a question for you, Garrett, if it came up with the DOC changes. Do you think that there's going to be a big uptick of referrals from agents to our programs that we offer, such as family treatment court, TOP, and then also just our regular treatment court to be used as a response to violations?
Absolutely. The biggest thing that we miss in DOC is MRT. We had it for a little bit, then it went away, and so we were leaning on the county. So once, I think we're already revamping all of our referral processes for ourselves in-house. And once we figure out, where we are as a society, are we staying home? Are we going out? Mask, no mask, vaccine, et cetera. I think you're going to see a dramatic increase in every resource that we have, because we're just scratching the surface right now as agents. And when we start, because for the longest time, jail was an accountability response. That was the primary response. Mm-hmm. But now, as agents, we're going to have to think more outside the box. We're going to have to look at every single resource that we have within our county, within our state, and we're going to have to apply those. So absolutely.
And just as an aside, we do have a request to come and present to DOC on the different, just a refresher on family treatment court, TOP, because it sounds like from Agent Gilbertson that we might see more TOP referrals come through for the case management support and the drug testing support and the accountability as a response versus revocation. So we might see more program referrals on that front as well, which ultimately is good.
I just have a question. So in light of that, so if DOC is doing more requests for referral to different programs, the person's already on DOC supervision and then the agent makes that recommendation to the court. Is that how that works, Garrett?
We could do it a number of ways. Like treatment court, for example, if we were to say the individual engaged in behaviors, that warrant a significant response, we identify the treatment needs. What we would do then is we would make our referral to like the treatment court, and then that individual will be assigned to Agent Gilbertson, and then that's how they proceed with something like that. So I know working with just everyone at the county, it's been so easy just to make a referral. It's basically here, fill out this form, or pick up the phone, give us a call, let us know who it is, what you got. And it's been really good. In fact, it's a lot easier using county resources, as far as the process versus the state resources.
Yeah, that's good to hear. It sounds like maybe a reasonable goal would be to increase our pre-charge diversion referrals and increase our top referrals. We do, on our dashboard, we do collect the number of referrals for some of the programs, but not other programs. That might be a suggested change, that we start looking at the referrals for all the programs to see how they're coming in or not coming in. But I think we've had just that court delay, so I think sometimes things come in fits and bursts as well. But I like the idea of increasing those program referrals and ultimately program participants.
Yeah, and I'd like to see, the end of, individual being placed on probation for 6 months, for a year, when we have all these other ways we can go about doing this. Do we need a conviction? Is it important to get a conviction for disorderly conduct to put someone on probation for 6 months? I would say no. I would say there's other resources we can use at the county level to better address that, because right now in this COVID era, I'm meeting with all my people through Google Duo, FaceTime, Zoom. I haven't met a single person on my caseload face to face, and I don't even know one. So how effective is it that I would think that in this world we live in right now, you have a young kid, individual who has been placed on probation for 6 months to a year, who will never meet their agent face to face. And a lot of the folks that I work with, they don't respond well in the first place to, these virtual meetings. We don't have that connection. We're having a hard time trying to insert that intervention that DOC is trying to do. So, I think that if they can look at something where they have a long-term benefit of not having that attached to their record, when they could take care of that up front, I think that would be more beneficial, one, to the system, probably to the state, for financial gain, and also, just for the individual. So I would love to see, that those diversions increase, triple, quadruple.
I agree. Can we add that? Should we add that to like our goals for 2021, Sarah? Is that something we can do?
Sure. Yep. I think that's something we should add to it. And then I can take it back to the executive. We meet at the end of February, but ultimately, I think they're wanting to see that we're making progress. We're looking at data. And I think that would be a goal that they'd agree with. Chris sits on the executive. Maybe we can hear her perspective.
No, I think that'd be great. I think that'd be a really good goal. It's really preemptive to deeper system involvement. And it'll keep Brad gainfully employed.
I don't know. This is one thing that I think's always been mentioned about the pre-charge too, is are you seeing a lot of those cases are they like state patrol cases, Brad, where it's like the disorderly or possession and paraphernalia charges from state patrollers that are going in pre-charge right now?
For the most part, yes. A vast majority of those that become pre-charged are state patrol stops and out-of-state people. Just a little looser restrictions on the out-of-state people to get on the diversion program than there is for local people. Just it helps to not bring someone over here from Minnesota or wherever they're from on a misdemeanor charge, and it also helps to alleviate for DOC on the interstate compact stuff. But yeah, I would say a vast majority is state patrol.
I also wonder if it would be like productive to do that. I know we've talked in the past about having an ordinance. Is it for the drug paraphernalia or possession of we don't have one for one of them. And I don't know what one it is. We have one for possession of THC, but not possession of drug paraphernalia. Is that something that we would be useful?
That would be huge, if we could use, especially when you consider the, I'm going to call it the temperature of the communities, all throughout the state. Simple marijuana possession or paraphernalia just isn't as egregious as it once was.
Maybe I'll talk with Andrea and Sheriff Big, and we could maybe work on that through judiciary and law as well. I know it's been something we've talked about, we've just never really acted on it. And I think if we're starting to do some of those goals and vamp up the program, we should start incorporating that as well as a tool for you guys.
All righty. So back to you, Katie.
I think we're at the next meeting to be determined. I don't know, is the doodle poll working good, or is that too much work, Sarah? I guess I'm flexible to whatever the group would prefer.
No, doodle poll's easy. So that's not difficult at all.
Okay, so let's do one of those for our next meeting date and time. And I guess at the end of the meeting, if nobody has anything else to talk about, we can adjourn and have a good afternoon.
All right. I just appreciate everybody's input. I think it was really